Hello, I'm Marion Briggs. I work at the Northern Ontario School of Medicine, and it's my privilege to be a Phoenix Fellow. I want to invite you to think about what it was like at the beginning of the last century, and to imagine and think about the incredible advances of science in the meantime. My grandparents came to this country from England by steamboat in the late 1800s. They secured a homestead in Alberta, and there started a new life in a new land. My grandmother bore 4 healthy children on the farm with the help of neighbors. Tragically, one young son, Billy, died at the age of 3 when he held a rusty spike nail in his hand and fell. The spike went up his nose and probably pierced his brain. There were no antibiotics. There were no surgical procedures. There wasn't even a hospital close by. And it took the country doctor 4 days to get to my grandparents' homestead. Billy's short life by then was all but over. Even if it hadn't been, there was precious little that country doctor could have done to save his life. Yet in my family's recounting of this tragic story, the country doctor was held up as a hero. He did many things that my family valued. Among them was his witness through the night that eased the inevitable end of Billy's short life, and the sharing of the grief that otherwise might have overwhelmed the still living. Science has made incredible advances, and we must surely be both grateful and amazed. But there has been a cost to this enormous progress. We have come to rely so much on science that other important and legitimate interests are being pushed aside. My Phoenix Fellowship aims to create conversations and to support thinking about healthcare practices that take into account science, but that don't stop there. Through developing health professional education curricula and supporting specific organizational conversations, my fellowship will help healthcare practitioners, students, educators to talk about, to value, and to take into account what is best according to the evidence, but also what is fitting based on the unique characteristics of the people and the context in which care happens, and what is possible as we act on and further improvise the decisions that we make in the course of our complex, unfolding days. Now, of course, I want us to be able to save Billy's life, but I also want us to witness suffering and joy, to know and consider one another as unique human beings, to be skilled in negotiating and recognizing the expected and unexpected circumstances that arise in our daily practice, to value a broad range of thinking, knowing, and acting. What we value matters. Science matters, but it cannot matter so much that nothing else does.